Imagine this. You're exposed to a common pesticide, and within minutes, your muscles begin to twitch uncontrollably. Your breathing becomes labored and your vision blurs. Would you recognize what's happening? And more importantly, would you know how to save a life? Here's everything you must know about organophosphate poisoning, a condition that can turn deadly in the blink of an eye. Organophosphates or OPs are a double-edged sword. On one hand, they revolutionized agriculture as powerful pesticides, but on the other, they're one of the deadliest poisons humans encounter. These chemical compounds, found in products like parathion, malathion, and chlorpyrifos, are designed to kill pests but can also wreak havoc on the human nervous system. What makes OPs terrifying? They don't just poison, they paralyze, and exposure can occur anywhere, on farms, in homes, or even as a weapon in chemical warfare. How does OP poisoning happen? Think of your nervous system as a carefully tuned orchestra, with acetylcholine as the conductor, ensuring every nerve and muscle responds perfectly. Now imagine that conductor going berserk, sending endless signals without pause. This is what happens in OP poisoning. Organophosphates block an enzyme called acetylcholinesterase, which regulates acetylcholine. When acetylcholinesterase is inhibited, acetylcholine builds up uncontrollably. Nerve signals overload, causing muscle twitching, spasms, and ultimately paralysis. Pesticides can enter the body through three main routes of exposure: ingestion, inhalation, and skin absorption. Ingestion occurs when contaminated food or water is consumed, or through accidental hand-to-mouth contact, which is a common route of exposure when produce is not properly washed or when pesticide residues are present in food. Inhalation happens when pesticide vapors, sprays, or airborne particles are breathed in, posing significant risks during application or in poorly ventilated areas. Skin absorption takes place when there is direct contact with pesticides, allowing chemicals to penetrate the skin and enter the bloodstream. This can occur during handling, mixing, or application of pesticides without the use of appropriate protective equipment. Can you spot a case of poisoning in time? Recognizing the signs and symptoms of organophosphate (OP) poisoning is critical because they can manifest rapidly, often within minutes to hours of exposure, and they fall into three distinct categories. Muscarinic symptoms result from parasympathetic overload and include excessive salivation and drooling, tearing of the eyes or lacrimation, frequent urination, diarrhea, vomiting, difficulty breathing due to lung secretions or bronchorrhea and bronchospasm, and pinpoint pupils or miosis. Nicotinic symptoms associated with neuromuscular effects involve muscle twitching and fasciculations, means small, involuntary contractions, which can progress to muscle weakness and paralysis. Central nervous system symptoms include anxiety, confusion, dizziness, seizures, and in severe cases, loss of consciousness or coma. To simplify recognition under pressure, the mnemonic sludge BBM is invaluable. It stands for salivation, lacrimation, urination, diarrhea, gastrointestinal upset, emesis or vomiting, bronchorrhea, bronchospasm, and miosis. Being able to identify these symptoms quickly can save lives, as prompt intervention is crucial in OP poisoning cases. Would you be able to identify these symptoms under pressure? How do doctors confirm OP poisoning? When it comes to diagnosing organophosphate poisoning, time is of the essence. Physicians prioritize identifying key indicators and rely on a combination of clinical signs, laboratory tests, and patient history to confirm the condition promptly. Clinical signs play a crucial role, with symptoms like excessive salivation, pinpoint pupils or miosis, and respiratory distress providing strong clues of OP poisoning. Laboratory tests are essential for confirmation. Significantly reduced plasma cholinesterase levels are indicative of OP exposure and are often used as an initial diagnostic tool. Erythrocyte, acetylcholinesterase levels offers a more specific measure for nerve agent poisoning and provides insights into the severity of exposure. Patient history is equally critical. Physicians investigate whether the patient had potential exposure to pesticides, nerve agents, or other chemicals. In cases of suspected self-harm, the history of a suicide attempt involving these substances can confirm the diagnosis. Accurate and swift diagnosis ensures timely treatment, which is vital in preventing severe complications or fatal outcomes in OP poisoning cases. How is it treated? Effective management of organophosphate poisoning requires swift action. Immediate intervention can save lives and prevent irreversible damage. Begin emergency action such as decontamination and stabilization like airway management. In cases of OP poisoning, the primary focus is on securing the airway, as respiratory failure can lead to rapid death. Immediate actions include establishing the airway, suctioning secretions, and providing supplemental oxygen. If the patient cannot maintain their airway, intubation and mechanical ventilation must be initiated without delay. Up to 25% of patients may require assisted ventilation. However, succinylcholine should not be used as it can result in prolonged paralysis lasting hours to days. Aggressive and prompt administration of atropine may help reduce the need for intubation by alleviating bronchorrhea and bronchospasm. Establishing an IV line and closely monitoring blood pressure are critical, though fluid administration should not be rushed to avoid complications. Decontamination is equally vital to prevent further absorption of the toxin. Contaminated skin and mucous membranes must be thoroughly cleaned with copious amounts of soap and water, and all clothing should be removed and replaced. If the poison has been ingested, gastric lavage and catharsis can be considered, though these must be performed cautiously. Healthcare providers handling contaminated patients must prioritize their own safety by wearing personal protective equipment, including masks, impermeable gowns, and rubber gloves, to avoid secondary exposure. Any spills or contamination in the environment should be neutralized with a dilute hypochlorite solution or household bleach to inactivate the organophosphates effectively. These urgent and methodical measures can significantly improve patient outcomes and minimize risks to healthcare providers. Simultaneously administer antidotes. Atropine is the most preferred drug which blocks parasympathetic overstimulation. Injection atropine should be administered intravenously at a dose of 0.05 milligrams per kilogram, or roughly 2 to 5 milligrams for adults every 10 minutes until signs of atropinism appear, which are typically dry secretions, delirium, restlessness, fever, tachycardia, dryness of the tongue, and dilated pupils. The aim is to maintain the patient in a state of atropinization until the toxic effects of the poison begin to diminish. It's important to note that the required dose of atropine may be much higher than the standard dose, with some cases needing up to 10 times the usual amount. There is no fixed dosage for atropine in OP poisoning, and it should be adjusted according to the severity of symptoms. In moderate to severe cases, injection pralidoxim or 2-PAM should be administered to reactivate acetylcholinesterase and is most effective when given early, particularly within 48 hours. The recommended dose is 25 to 50 milligrams per kilogram IV, means roughly 1 to 2 grams IV for adults, with a slower infusion rate as 250 milligrams IV over 5 to 10 minutes for older children and infants. This can be repeated every 8 hours for up to 36 hours. Caution should be taken as PAM is contraindicated in carbamate poisoning like neostigmine, physostigmine, rivastigmine. To manage muscle pain, paracetamol or non-opioid analgesia should be used, as opioids may exacerbate respiratory depression. Continuous monitoring of the patient is necessary for 72 hours or longer, as OP compounds may be intermittently released from fat stores. Use diazepam for seizures or restlessness caused by overexcitation of the central nervous system. Monitoring should include ECG, arterial blood pressure, SpO2, and chest X-ray. Close observation is critical for detecting any deterioration, particularly after reducing drug therapies. Auscultate the lungs for crackles, as this may indicate fluid buildup in the lungs. If crackles are heard or there is a return of meiosis, bradycardia, or sweating, atropinization should be re-established. Certain medications, including morphine, succinylcholine, theophylline, phenothiazines, and reserpine, are contraindicated in OP poisoning due to their potential to worsen symptoms or interfere with treatment. Organophosphate poisoning, even when treated, can lead to severe long-term complications. Delayed or inadequate treatment may result in intermediate syndrome, characterized by respiratory muscle weakness that occurs 1 to 4 days after the acute phase and often requires prolonged mechanical ventilation. Weeks later, patients may develop delayed neuropathy, which manifests as tingling, numbness, or weakness in the limbs due to nerve damage. Additionally, chronic effects such as anxiety, depression, memory issues, and persistent neurological symptoms, including tremors or difficulty concentrating, can significantly impact the quality of life. Prevention remains the best defense against OP poisoning. To minimize risks, individuals handling pesticides should always wear protective gear such as gloves, masks, and appropriate clothing. Pesticides should be stored securely in clearly labeled containers away from children's reach. It is equally important to educate agricultural workers and farmers on safe pesticide handling, application, and disposal practices. Opting for less toxic pest control methods, such as integrated pest management, which combines biological and environmental strategies, can further reduce reliance on chemical pesticides. These measures collectively help mitigate the risks associated with OP poisoning, safeguarding both individual health and community well-being. In essence, organophosphate poisoning isn't just a health issue. It's a ticking time bomb in agriculture-heavy regions. Early recognition and immediate treatment can save lives, but prevention is the ultimate cure. Would you know what to do if someone showed these symptoms? Share your thoughts below and help spread awareness. It could save a life. See you next time. Keep watching MedGrow and take care of yourself.